Good evening, all. Welcoming all to this Nadeeswara special class conducted by Yoshi's Kerala Group and Basava Accu Academy jointly. Nadeeswara is a diagnosing instrument through which we can find out almost all the details or the conditions of a patient. And this instrument itself will lead us to give a very good therapist by providing a single point for all the problems of the patient as per his condition. It will give 100% results also. Now this device is spread among the therapists very fastly. Today's class will be benefited for the owners of Nadeeswara as well as those who are wish to buy this Nadeeswara in nearby future. Now I am welcoming Basavara sir to explain more about this instrument. Good evening, sir, and
Good evening,
welcome
madam.
to this platform. Good evening. Thank you. Now you can carry on.
Yeah, wait another 2 minutes. People are joining now.
Okay, sir.
Okay. Welcome to the pulse diagnosis session through Nadeeswara. Today we will discuss how effectively we can use Nadeeswara and what are all the things we need to study. Let's discuss one by one. If you have any questions, you can just chat in the chat box. I will read and I will explain to you. Okay. Good evening, Ansuya, Lakshmi Priya. Okay. So what is Nadeeswara and how best we can use this device? Let me see one by one. So if you want to treat in any methods, the primary thing is a diagnosis. So Anasuya Parkade, I will text you tomorrow morning how to do that. Okay. What? So there's a many ways of diagnosis is available. People are following. Okay. Out of that, let me check. Many people, their expertise in different ways of diagnosis. Someone will diagnosed through voice, through face, through tongue. So out of which pulse diagnosis is also one of the way we can analyze a pulse. Then what is this pulse diagnosis? How best we can do? What is the accuracy of it? Will it tells any diseases in the body? Okay. All these questions comes to mind. So if you go to any Nadeeswara or any other pulse diagnosis or Nadi Pariksha diagnosis, the first question comes, through pulse diagnosis, what we can expect. That is the first thing you should understand. Then only we can make use of best way. What we can get through pulse. That's the first question. The next question is what we can get, what we can expect from the Nadeeswara is the second point. Let me finish the first question. The first question is, so my voice is breaking. If I just give me a second, I'm just analyzing. Now you check. I think my voice is corrected. Is it fine now? Okay, fine. That's good. What we can expect from the pulse? Because in today's world, we are naming more than 4,000 diseases names, out of which, okay, we cannot guarantee you that, okay, through pulse, I can diagnose your cancer, I can diagnose your AIDS, I can diagnose your heart problem. No. But through your experience, you can tell. You may get this sort of symptoms. Okay, because the name is given by a mankind. Yes, no? For example, let's take a simple example. If we have stomach indeficiency. Stomach indeficiency means we don't have enough fluids in the stomach. For that, we can rectify, we can correct it. Okay. But the modern science, it is named more than 20 different diseases for stomach indeficiency. Gastritis, constipation, ulcers, acid reflux, bitter taste, and so many different names we give. If you have any questions, we will make a separate question and answer session after 9:30. Is it fine? Dev, you are raising hand. I'm just telling you. Otherwise, you can just have a question later. You can move. Dev, you can unmute and talk. Dev. I think I'll give you a chance to discuss. Let me finish how best we can reach this pulse. I think up to 9:30, just put your question in the chat box. After 9:30, we will allow you to ask the questions. Okay. The intention of this class is to make you to understand what is pulse, what we can get from that, how you can use that data in your diagnosis, and how best you can treat the patient. To make you a better, we are doing this course. Okay, we do oftenly. The final intention is overall having Nadeeswara. You should use effectively, successfully. So that is possible only when you read what it is. Okay. So I told 2 questions. First, I will answer you. Later, I will answer remaining. The first question is, what we can expect through pulse diagnosis. The second question is what we can expect from the Nadeeswara. So pulse diagnosis, through what we are diagnosing? We are diagnosing through a radial artery. Is it correct? So we are checking the radial artery. So I can show you that. This is the radial artery. I think you can see in the picture. It is a pulse which is we are experiencing through your heartbeat. So indirectly, you are checking the heartbeat at which rate it is pumping and what is the rhythm of it, what is the speed of it, and what is the pattern of it. So finally, heart is the one which generates the pulse. Okay. Okay, by just touching on the blood vein, what we can get? So just a minute, my voice is breaking. I will check what is the reason.
Voice is okay, sir.
Okay, fine. We will start. For the interrupt. So come back. So through pulse, what we can get, what we can do analysis, let me check. Okay. Through pulse, we are getting the data and we are checking some ideal pulse, what is the pulse, all those things is secondary. So here the main analysis is we are getting the patterns, different patterns like this. I think overall using Nadeeswara, they already know the different patterns you are getting. So apart from this, mainly we are getting a few patterns in the pulse diagnosis, different patterns you get. So today we will analyze what is the meaning of that pattern and from that what we can get. I think we're all studying pulse diagnosis. They know about different patterns. I think there's a 28 different patterns it will diagnose in the normal Chinese medicine. So out of 27 different medicines, different patterns, we observe few and we will conclude. So what may be the best and what we can correlate everything. Few of them I will note down here. So let me give a different analysis. So many of us, we come across with different patterns. So let me check what are those different patterns it will analyze. Even check my video if it is right, and video and voice, and we will continue in this network only. So
your video is off, sir. Only
I switched on the video now.
Yeah,
It's fine now.
it is fine, sir.
Okay, fine. Switch off this. Okay, fine. So even I kept 3 different Wi-Fi's and network and all. Sometimes trouble happens like this. Sorry for the interruption which happened through internet. So many healers, doctors and alternate therapists like Ayurvedic, naturopathy and acupuncture, homeopathy doctors, even many English doctors are referring the pulse as one of the parameter. So this is the one parameter. Apart from this, you have to add few more parameters to make it complete diagnosis. So in this pulse diagnosis, a Nadeeswara instrument will help you to diagnose. So what is the nature of the pulse? So different nature of the pulse we will see. For example, it's based on the speed. What is the speed of the pulse? Okay, so clearly in the Nadeeswara it will mention. So what is the pulse rate? If the pulse rate in between above 65 and below 85, we will consider it as a normal pulse. So more than 85, we will consider it is a speed pulse, and less than 65, it will be a slow pulse. This is a normal measurement. This is one of the parameter to indicate you the whether given pulse it belongs to the yin or yang. This is a one parameter. I think it is not again a complete one, but you can take, if anybody is having pulse rate more than 85, 90, 95 like that, it is indicating that they have excess of yang energy, and it is less than 65, like 60, 58, 56, like that, few people will come. So that will belongs to the yin. That is one of the parameter of the pulse diagnosis normally which we measure. The second important thing, so we are going with some of the parameters in the pulse, like few nature and indications we go. So that I will show you by writing on the sketch. Let's take one example. I will take. We will make slippery pulse, and we will make weak pulse, or it is also called sunken pulse. And we make it some of the like a hook pulse and choppy pulse and wiry pulse, like that. Many different pulses we go with this, like slow pulse and fast pulse. In Ayurveda, we go with gati of the nadi, means pattern of the pulse. So like sarpagati means one pulse which is snake tape, and frog indicating pitta pulse, and crane, it is indicating the kapha. By seeing all these things at different types of pulse, so what we can conclude? Our ancestors, on what parameter of the pulse they are giving importance. So last three, which I mentioned, snake, frog, crane, it is based on Vata, Pitta, Kapha, based on Ayurvedic principle. The above 8, which I wrote, which is based on the TCM. Different pulse, we will go with this. So like that, many more parameters like hidden pulse and intermediate pulse, missing pulses, okay, and spiky pulse. So many different way we diagnose. I think many of you learned one of the way we thought is how to find yin and yang in every organ. So that we thought in the TCM class. Let's just assume it is another way of looking into the pulse. So now overall attended and completed pulse diagnosis, that TCM course. I think you are able to analyze and diagnose what is the different pulse. So you measured, we will take 12 different pulses and 6 different positions based on upon the intensity of the beating and fast beating. We are analyzing, we are diagnosing in each and every organ. It's a yin or yang. But there's another way of looking into the pulse by observing. There's a 10 different pulses. You can take here, you can take here, and you can take in the pubic area. You can take in the where we are finding K5 pulse acupuncture point, and you can also take in the radial artery. One position. Any one position if you take, you should be able to get some information from the patient. So what may be that information? That information may be how he is. Okay. So what you want to get the information? That information normally we will go with the 5 elements we need, because most of our diagnosis which goes with the 5 elements. If one able to diagnose, so what are all the elements our body is dominating, and what element is depression, and what may be the symptoms, expected symptoms you can see. All those things we can get it through a pulse. The first, let's take, I think many of us we are familiar with Nadeeswara report. I will just roughly I will open one report. Okay. Let me check. Okay. I will take one simple diagnosis. I will show you one report, then we will go into this. So this is the report it will generate, the patient name and all the details. Along with, it is also indicating some heart rate. Now just text me in the chat box, if the heart rate is 98, what we can expect? 98 is the heart rate. What may be the a pattern of the pulse which we can expect? Lalita madam, please enable the charting so that people will share their view. So it's a more yang, of course, it's a fast pulse. So yang means definitely more heat. Narayan is telling it's very good. It's a speed pulse. Okay, definitely it is fast. If it is fast means its yang is excess. Good. So you can straight away, you can say there will be a heat will be there in the pulse. Am I right? So looking at the pulse rate, we can tell there will be some heat. Okay. So we will go to the next step. What may be the pattern of that patient? Okay. So cardiac information, it is giving the variation of the pulse pattern. So it should be a straight line. So at last one peak is not a problem, but it should not be in zigzag. If you vary the pressure of the sensor, so you will get zigzag, that you won't get the proper pulse. Try to keep your sensor on the pulse with constant pressure so that you will get the pulse. So that already we shared you some of the videos how to avoid the pulse error. So if you have any doubts, you can go through video multiple times and you can text me back if you are not getting that. Okay. And come back. So here is the 5 different patterns we could able to analyze. Okay. The first one, because his patient is heart rate is 98, by that itself we can able to get, okay, there is a heat. So here also the heat is rising up in the 5 element pattern. So now If heat is rising out of the 5 elements, so what could be the rule of that pulse? So many of you are getting confused with the patterns. Please listen for a few more seconds. So if you have any doubts, I will clarify again, okay, in the question answer session. In the body, the heat will generate with there's a 2 different ways. One, heat, it may be generated due to excess condition. Yes, excess heat means it may be a pathogenic heat, or it may be a food infection, or it may be a liver may be secreting more pitta, that also causes more heat, and stomach gastric secretion may be a more, that also causes more heat. And maybe you are more of into the hot conditions, and you are into the more of heat area, or excess of physical work. Many conditions which generates excess heat. It is also called true heat. Means it is a excess of heat which may generated due to either liver or stomach. So that is heating. There's another way in your body heat is generating. So that is called deficient heat. It is also called false heat. It is also called in heat. And it is also called empty heat. All are same. What it means? Means the heat which is generated due to a deficiency of the coldness. So normally the heat and cold okay, fine. But there's the issues with the connection. From my side, it's fine. Don't worry. Continue the class. The heat is which is true heat or excess heat. It may caused due to your lifestyle or food conditions that may rises. For example, few people that are taking more of young food, more chicken, egg, and the food which is creating heat, or more spices, all those things, it is rising the true heat. The second type of heat, the heat which is created due to a deficiency of the coldness in the body. Your body fluids, your vital essence, what we call your sexual vital fluid, or the sinal fluid in the bones, what we call in Shukra Dhatu. When your body fluids are going down, so automatically due to your fluids or coldness is too low, it's unable to control your yang. So that's why it is rising up. So this is a false heat. Okay. So how to identify in the Nadeeswara whether it is a true heat or false heat? It's very simple. Along with heat, okay, if you have slow pulse, or if it is a low pulse or a weak pulse, so that time you are getting the empty heat. So here you just tell me, if I say weak pulse, out of 5 elements, which is the more weak pulse? Low pulse or weak pulse or deep pulse? Is it fire, water, air, Akash, or wood, or earth element? Which one is very weak among 5 elements? All are giving same answer. It's a water. Yes, it's true. Water is one of the deepest pulse and slow pulse. It need not to be a slow, but it will be a weak. It won't rise up. I think while taking pulse, you might get to know few pulses. It is heating up like this. When there is a humidity, wind, heat. But when there is a cold pulse, it won't heat up. It is going like this. So that I can share you with another report. See, your slow pulse will be like this. Are you getting this? I am showing the pulse which is having water content. It is very deep. There is no big amplitude it comes. It is a very low amplitude. You can see here. You can't see? I'll just share you with another perspective. Just a minute. Are seeing the pulse? Now you check.
Yes, sir.
So this pulse doesn't have more amplitude. I think many of you got this type of pulse pattern while taking the Nadeeswara pulse diagnosis. Yes or no? Many of you, when you're taking pulse, have you got this type of pulse? So if you are asking, just show through and, okay, I will show through and. So I will write it on this one. This is a normal pulse with a better amplitude. The weak pulse will be like this. Are you getting this? Which I am writing. See the difference. This has a more amplitude and high pulse. This is having the low amplitude. Where there is a low amplitude, this is indicating the water element. And it is also indicating deficiency pulse or weak pulse, you can say, or someone call it a deep pulse. But which is above 1, this will be having wind or humidity pulse. It is also called a slippery pulse. Again, we will divide whether it is belongs to the wind or humidity or slippery. But finally, it is having more of yang nature. And this is having more of in nature. So now, come back here with respect to the which one I shared. This is the report I shared with you. So now you tell me the fire which you can see here, which is a true fire or false. It is a true heat or empty heat. Why it is a true heat or why it is a false heat? I cannot call it is a false heat because here water element is low compared to the earth. Earth is the one which is a higher pulse. Even false heat is also having more fast. Even many people we saw is having false heat with 9800 pulse rate. So we cannot diagnose with only a speed. That's what I told. You cannot correlate. If heart rate is more, it will be a true heat. Heart rate will be more for true heat as well as false heat. But how can you differentiate between true heat and false heat? Means if the secondary element, if it is a humidity or wind, it may be a primary or secondary. So along with fire, if you find Akash or earth, then we can call it as it's a true heat. In normal, most of the times we call it with damp heat in the spleen or a liver fire blazing and excess of heat in the small intestine and stomach. So different parameters we will take in the next step. So by looking at the fire element, you can conclude that if the water element is low, less than 0.15, then we can conclude that this is not true heat. This is the heat which is generated due to a lack of fluids in the body. I'll give you another pattern so that you can understand better. Many of you are getting, yes, definitely Nilima. It's an indeficiency pattern. Good analysis. I'll give you one more so that you can get easily. I'll share you another one, which is indicating false heat. Look at this pulse. Now tell me, is this true or false heat? It is a empty heat. Correct, no? The true heat we consider if there is a akash or wood or earth element is more. Kumaresh, here wood and akash is less than water. Means it is a empty heat or indeficiency or in heat you can tell. Mohammed, is it clear for you? Amin Mohammed? The heat which is generated due to a lack of fluids in the body. Good. So now we understood that if the fire is more in your pulse, again, how to get manually the pulse? And normally a fire will be more. In which season you can expect more flowers? Because bud is related to wind energy and fire is related to summer, and fruit which is related to earth element, which we heat, digestion system. It is summer only, no? Any doubt in that? No. Means whenever you find a fire pulse, we correlate that to the summer. Summer, what we can expect? You can expect the flower. Humidity means which is a digestion system, which you can expect a late summer or a beginning of the rain season, which is indicating the fruit. Now, when you are checking pulse manually on the radial artery, if there is a fire, you can feel the pulse like a flowering. If this is your pulse you are checking, how the pulse will be, how the bud will become flower, like this you can feel. It splits like this, how the flowering happens. Similar way, if you keep on the radial artery, it will be like this. Means when your radial artery splits into many angles, like a flowering, then we call it as it is a fire pulse. So that is not a complete diagnosis to treat a patient, because all of you know that we are using different acupuncture points for true heat and empty heat. And your analysis also completely different. And the food suggestion and lifestyle suggestion, everything will be different for true heat and empty heat. True heat always comes with humidity and wind. Because how is your energy levels in the spring and late summer? It will be high. Your humidity pulse or earth pulse, what we say, it is like your fruit only. Your pulse never ever misses the 5 seasons, never ever misses your nature flowing. All of you understood that your fire will be like a flower. Similarly, how will be the earth pulse? So your earth pulse will be like completely into its humidity pulse. Like this. Are you able to see this pulse? So this is indicating there is a fire and there is a humidity. Means humidity means it's a fruit, it's a nourishing, it's an earth element. The person is having solid fire, a more heat in the body, and it is a condition of acute illness. It is not chronic. It may fever, or it may be a gastritis, or it may be due to some excess of heat exposure or heat food. Symptoms which a patient feels, it is not chronic. If you treat this condition, it may take a maximum of 2 weeks to solve the issue. A max 2 to 3 weeks is a maximum. We can solve this condition. How we can solve this condition? Next question. Okay, if it is a true heat, which are all the elements you can treat? So if it is a true heat, all of you know that I explained in the class, there is a chances of heat which happens only in 2 elements. The true heat conditions, it happens in the 2 conditions. So one is what we call Akash or wood element. The other one is fire or heat element. The third one is earth element or humidity energy. Fourth one is air or metal element. It is related to dryness. Water or the energy is coldness. Let's give me a small answer. If the fire is excess, that too along with wood and Akash, which is related to a fire element. So all of you know that there is a creation cycle, control cycle, everything. Okay. One element creates other element creates other. It's a cycle, it's happening. So according to the TCM principle, we consider wood and fire, which is the yang elements, and water and air, which is related to yin elements. Then humidity, it will be a transition. It will be both yin or yang, depending upon the pair. It is a transition state. So now, if the fire is there along with Akash or along with humidity, we consider it is a true heat. The symptom of true heat may be a airfall, because when heat increases in the body, so automatically the fluids will go down in initial conditions. That may make some blood deficiency if you won't treat in the long run. Due to this, they may feel some hair fall, some pimples. I think people who are in maybe 16 plus age, they have more true heat. They may get some pimples, some dryness of their face and ears. So all these things, it's a temporary symptoms. Even you get this when you have excess of heat in the body. This, when fire element is along with humidity or wind. The second condition is when fire element is along with water. So that creates the empty heat. As I told, this will be an acute condition. And this will be a chronic condition. Why I say chronic condition? What may be the reason? Why? Because this heat is created due to a deficiency of the fluids in the body. Fluids are very essential to nourish your bones, muscles, and fluids in the joints, and even it is this essence is given to moisture your skin, hairs, and it is giving in energy to the digestion system to hold the food, and it is giving fluids to the heart, okay, and increasing the heart blood. Everywhere these fluids are required to a normal generation. Similarly, when this fluid itself is less, it's a similar condition. If you're not replacing engine oil for your two-wheeler more than 2 years, how it will be? The same condition happens in the body. When fluids are too low in the body will take a lot of time to rejuvenate. It's not an easy task. According to my experience, it will take more than 2 years with proper treatment along with proper food and lifestyle. For example, the fluids are going down due to maybe a stress. The fluids are going down in the body, maybe due to malnutrition. The fluids are going down due to excess of sexual activity. The fluids are disappearing, maybe a excess of desires without having control on your activities, on your thoughts. So there's so many ways your fluids are going down. There's a simple, the fluids will become weak if you won't do any physical activity. Because you're simply consuming the fluid by watching videos, TVs, net, this, that, and all, and you are not generating it. You're not eating properly, and you are not doing physical activity to create hunger to digest your food, where you can see the more fluids in the body. So there's so many ways your fluids will go down due to age also, because with respect to age, your production of fluids will go down because of the weak digestion and all. Maybe it happens naturally, it happens 70 years later. If it is happening with the 20 years or 30 years itself, means definitely your food and lifestyle and the way of thinking is not proper. No one will correct you. These things you have to correct yourself. Many of us, we are working without taking rest. And many kids and many youngsters, they're preparing for exams and competitive exams without having proper nourishment, without having proper production of fluids in the body. We may call it now, I have a lot of stress that due to that BP is rising, lot of stress due to that blood sugar is varying. What is the stress? Because you are unable to control your desires. You are unable to control your thought patterns. This is mentally. Physically, you are not putting effort to burn your food and fat. You're simply consuming the energy every day and you're not creating it. What happens? Finally, you end up with indeficiency. In means fluids. When there is a indeficiency, fire will rise up. The secondary element will be either dry or cold. It is not wind or humidity. If it is a true heat, the problem will be very easy to solve. Maybe a blood deficiency, you can take some iron supplements. If there may be some fever, you can take some paracetamol. There may be some infections, you can take antibiotics. For the true heat, there is a solution in the modern science. Who are all suffering with true heat, they won't come to you. They will solve the issues within 2-3 weeks with the normal modern science, medicines and doctors. Then who will come to you? People will come to you who is having chronic indeficiency in the body. So indeficiency will happen majorly in 3 organs. One is kidney, another one is liver, another one is heart. These are the 3. Rarely it happens with spleen indeficiency. People will get anal prolapse and rectum prolapse or piles. That can also be solved. But the issues with respect to the liver, heart, kidney, these 3 organs require more fluids in the body. Why kidney requires more fluids? Because it has to nourish the entire bone, skeleton system. Why heart is required fluids? It required fluids because one is circulation. The second one is it has to nourish the mind. 20% of the blood is consumed by mind only. Who is giving blood to the mind? It's the heart. If heart having indeficiency, so you end up with blood deficiency to the mind, you end up with a restlessness, anxiety, depression, palpitation, fear, all these things because heart doesn't have enough fluids or blood to nourish your mind. All skeleton system become weak. People are getting slip disc and back pain, cervical spondylosis and knee pain, bone weak and gynecological issues, sexual problems and infertility. All these things is related to kidney indeficiency. Third is the liver. Liver fluid. Our liver is the one which is nourishing all joints, ligaments, tendons, and muscular system. When liver is very deficient, your muscular system is very weak. By doing small work also, you feel tired. You cannot continue your work long term. And it also makes some dizziness due to liver indeficiency, making liver heat is more. It also makes joint pains. It also weakens your vision. Many more things. So whomever you are getting the pulse, The primary is fire, the secondary is coldness. For them, it's not only a treatment is necessary. It requires more than that. Correcting their mind, correcting their food. And if they are doing some sexual activity or masturbation, that has to be corrected. And if there is a aged people, for them you have to take special care to avoid losing of the fluids. You should nourish them with proper food, and you have to reduce the spices in the food, especially for aged people, because the young people can recover with effort of 1 or 2 years, but aged people is not like that. There's the small resources or small fluids are available in the body. With that only you have to manage. They cannot reproduce like young people. So many cause when these fluids will go down, and it is creating the many people, they are getting the pattern of empty heat. Have you got this pattern when you're checking the empty heat? So here there may having issues, any 3 elements. I'm not telling only heart, only kidney or only liver. Maybe all 3 is deficient or any one is deficient. Then how to identify this? Up to here, your Nadeeswara will guide you. It will guide you. What it will guide you? There is a indeficiency in the body. Due to that, the empty heat is created. There is a damp heat or true heat in the body. Due to that, that heat symptoms are there, like anger and more of aggressiveness, pimples and skin infections and urinary infections. That is a true heat, it is created. But you should take very carefully how best you can treat a patient. Nadeeswara will give you guidance. It is also give you some points. That is not enough to treat the chronic conditions. You should also have the knowledge of what happens if there is a kidney indeficiency, what happens if the liver indeficiency, what happens if the heart indeficiency. Nadeeswara given a guidance. There is a indeficiency in the body. Due to that, heat pulse is very high along with coldness. This heat, empty heat, when fluids are going down, one thing you know that all the secretions happens in the fluid way only. Your pituitary, pineal, thyroid, pancreas, adrenaline, testosterone, all the endocrine glands which you see, it's the fluids only. All the hormones which is created with your kidney essence. What fluids you can find in the bone, no? That fluid is the root cause for all the endocrine gland working principle. When this fluid will go down, when you find the Nadeeswara pattern with heat and cold, that is indicating that there is no enough fluids in the body to give a raw materials to the endocrine gland. That's why when there is a indeficiency, first symptom, pineal pituitary is a master gland won't work properly because of the lack of the raw materials. The first symptom is insomnia, sleeplessness, or disturbed sleep, or dream disturbed sleep, or not deep sleep. Any you say, according to me, when you say you are not getting sleep properly means I'm just assuming that, oh, Nadeeswara is showing heat and cold. Oh, there is a indeficiency. There is no enough raw materials to the pituitary and pineal gland. That is, they are responsible for to make your mind calm and go to sleep, deep sleep. That is not happening. Next, thyroid. Thyroid also require raw materials from the Shukra Dhatu only. When indeficiency in the body, thyroid is unable to do its job. People are feeling hot flashes, weight gain, weight loss, and many more symptoms, mood swings, all these things, thyroid imbalance that is connected to the even gynec that makes progesterone, estrogen hormone, luteinizing hormone, follicle stimulating hormone disturbance. Okay, there is a disturbance of thyroid gland. Have you checked why thyroid gland is not working? Because it is not vital organ, it's the endocrine gland. Even if you remove thyroid gland also, you can survive with the thyroid tablet. Then why you need? You need to proper functioning of your body to maintain your metabolism, to maintain your body temperature. Thyroid is working. But who is running the thyroid? The kidney essence, the liver in energy, kidney in energy, heart in energy is responsible for thyroid functioning. That has to be treated with proper, even Nadeeswara pattern, which is suggesting some points. Along with that, you have to check. Okay, if ladies are more possible of getting thyroid imbalance, you have to check. Many ladies, they're working in home as well as in the office, and a lot of stress related issues, maybe some emotional imbalance, relationship variations, maybe a lack of physical activity to create enough fluids in the body. Many more things. Or some desires are not fulfilling, that's mind is keep on running, it is consuming a lot of fluids. Finally, body doesn't have enough fluids to run your mind. Yes, no? It happens. It is consuming more and more and more. Body will give you at the age of 20, 25, 30. By 30, it is telling, you're thinking more, you're running more. I don't have enough fluid to supply you. Because your lifestyle is too weak. You are eating nonsense and not doing any activity. By that, fluid is not creating. And it is a cycle. If it is fluid is not creating, it is unable to nourish your mind and body. That the way your empty heat is generated over the period of 5 to 7 years of your mistake in the mind, food, and body. And you cannot expect to solve that within 1 or 2 weeks. Even though you have Nadeeswara, it is given input. It is giving input. It is also giving wonderful points to reduce indeficiency, to raise the fluids. Okay, to raise the fluids, to reduce the indeficiency, what I treat through Nadeeswara, I will give you some wonderful points which is reducing the heat and raising the coldness. When coldness rises in the body, it is able to hold the food, it is able to absorb the food. That environment I'm creating through Nadeeswara. I'm creating an environment to receive and hold the food. After treating with point and after analyzing the pattern of indeficiency, it's your responsibility to change your lifestyle and food. In my close relationship, in many of my friends and many of my clients, I treated this indeficiency. Myself, I took more than 1 or 2 years time to rectify it. I have a proof before and after thyroid, before and after diabetes, before and after BP. But finally, The healing has to happen within a body of the patient. As a healer, what you can do? Through Nadeeswara, you can take a report. It is telling heat and cold. It is an indeficiency. To solve the indeficiency, there's a set of points. So Nadeeswara may be suggesting you 1 point at a time, maybe 10 to 12 different points it is suggesting you. Okay. With that point, with that diagnosis, you can also take the tongue. If there is an empty heat, the tongue will be red and coating will be very less. Okay. The tongue coating will be less for the empty heat. There's another way you can cross-check. After cross-checking with Nadeeswara and tongue, with the symptoms also you have to check. I will tell you some of the symptoms which is related to indeficiency. I'm just showing from anyone website. This is a kidney indeficiency. Are you able to see? If not, please text me in this one. Yes, Guna Shiva, it happens. Due to heavy work without having rest, your fluids will down. If it is a kidney indeficiency, these are all the fluids. It is not clear. You can see, or you can, shall I zoom it a little bit? Are you able to see, Mohammed? Are you able to view or not? Please check once. Just, I will give you 2 minutes time. Just read yourself. So many of us, we are feeling different types of these symptoms. Your indeficiency never happens if you are able to create enough in. Indeficiency won't happen. You have to create in every day. That is more important. I'm sharing a letter. This is another indeficiency with blood. It is with liver. It is with heart. If heart in is deficient, you may get heart palpitation, nightmares. You may get anxiety, chest pain. Okay, don't worry. I will share you symptoms which is related to kidney, liver, and heart indeficiency. Because today's pattern, I explained you how the empty heat is created with heat and cold. and how it will affect your body. I will share you in the Joshi's Kerala group and as well as BAA group. So are all attending. So when you take a report from Nadeeswara, first you classify. I will take a few more classes in upcoming weeks. Okay. Today I explained heat and cold, one pattern. Okay. I will explain you many more patterns like this. And you can learn a lot and you can use your Nadeeswara effectively. And if you are anybody of you are planning to take Nadeeswara, I will suggest you go through a few more classes, understand the concept better, then only you take Nadeeswara. Then only you can use effectively. Without knowing the concept, how the empty heat is creating and true heat is creating, and how we have to change your food and lifestyle, it is very difficult to cure. Few people, they yesterday in the Nadeeswara group, they asked about the stomach bloating. It is related to spleen yang deficiency and kidney yang deficiency. So in the next class, I will explain you about the yang deficiency. And of course, you remember this, especially deficiency related issues, indeficiency or yang deficiency. It will take minimum 1 to 2 years effort to come out of it. Due to that indeficiency or kidney indeficiency or liver indeficiency, your BP is more. You may taking BP tablets for since 4-5 years or 10 years. But if you properly follow your Nadeeswara pattern along with points and corrections, if you put effort 1.5 to 2 years, definitely you no need to take medicine of BP. People used to take till their death. No, that is not required, because the BP tablet which you take still weakens your body fluids. Then still empty it will be more. Today you are taking some maybe 10 mg of amlan. Maybe after 3-4 years it is not sufficient. You need 20 mg. Then you need 40 mg of amlan medicine. Why? Because you are not solved the issues of the indeficiency. You just suppress the medicine. You took the medicine which is working for 24 hours. Next day, if you are not taking, the again BP is rising up. BP is rising up because of the empty heat. Why that empty heat is created? The fluids are very less. It's unable to control your yang energy. Why fluids are deficiency? I told. Why that heat and cold pattern? I think who are all using Nadeeswara, they are aware of this pattern, heat and cold. Maybe if you take 10 reports, how many of you are getting heat cold pattern like this? Please text in the chat box. If out of 10 reports, how many patients are getting heat cold pattern? 3 for Gopinath. Jagdishwari, she's telling 6. Many users are there, Nadeeswara users. Amit is telling 4, means 40%. For Ramesh Kumar, it is 8. Girija 5, good. So I can take on an average 50% of the people, they are suffering today's disease with indeficiency. I think I need one more class, how to correct indeficiency through food, lifestyle and thought pattern, so that then only this class will be completed. Today I explained you what is Nadeeswara, what is pulse, how heat is created. Okay, what is empty heat and true heat? We're not given more importance to the true heat because it's acute condition. That also we will explain in upcoming class. We took the empty heat, how the empty heat is created. Okay, and how it is affecting the endocrine glands, digestion system, and how it is affecting your entire cycle of your body. And it is a root cause of your many chronic illness like diabetes, BP, thyroid imbalance, low back pain, and osteoporosis, many more. Okay, so of course, Joshis are putting a lot of effort to enlighten the people through TEM course, Traditional Energy Medicine course. Recently, second batch of TEM with 140 people, we executed successfully. Few more revision classes we are taking for them. Finally, everyone has to learn the system. Okay, we'll go together. So I think Joshi sir is there on the line.
Yes, sir.
Yeah, so he may
Tomorrow we can continue, sir.
third batch of TM, Traditional Energy Medicine course. So people who want to join the course to go in depth, and from the first batch of TM and second batch of TM, if you want to repeat the course, because my course most of the time it is completely, when you listen second class, it's different again. The way our flow will come, because we use PPTs are very less. We are going with the concept and the understanding with the real-time examples. So if anybody wants to join the course, you can inquire with Joshi sir. So I don't know when he is going to announce the dates. Even I am also waiting. So over to the Joshi sir.
I plan to start on next month, first week.
Maybe next month, first week.
First week or second week?
Sure, sir. That will be a ideal time. So maybe many people are asking after Maharashtra Council exam. Check it out when it is. So we will. We not only a pulse diagnosis and points. We also did extensive research on the food. Which are all the food which weakens your body fluids, and which are all the food which enriches your body essence and all. So that we will discuss in the upcoming class. We will learn together. So we are sharing our research experience. Okay. So definitely, if you want to repeat the course and if you want to join the course, please contact Joshi sir. So he will organize. His organization will be excellent. He maintain everything proper on time. And he will share all the resources, everything. Okay. So what is my aim is, so I want to enrich you with more and more data and more analysis, so that every year, even myself, our success rate is increasing. 8 years back, my success rate is 50%. 5 years back, my success rate is 70%. 3 years back, my success rate is 85%. 1 year back, my success rate is 90%. So every year we are growing and we are reaching the people with maximum efficiency. So I want to wish you should yield the people with more than 90% success rate. There is no patient like that I cannot treat him. There will be some chances that you can find through pulse and tongue diagnosis with food and lifestyle correction with acupuncture point. So I think council exam is on October 10th. So after, better sir, you announce in the 3rd week of October.
Yes, sir.
Okay, so that more people will benefit with TM course. Okay.
Okay, sir.
So
Today's class we can continue tomorrow, sir. Balance.
If people are ready, I will come back tomorrow.
Okay.
Okay.
Then
Sure,
we
sir.
will continue tomorrow.
Sure, we'll. Tomorrow sharp 7 o'clock.